speech-language pathologist here at the Center for Pediatric Therapies downstairs. And I also am a speech-language pathologist in Parkersburg at Taylor Therapy. So I go to both locations for our clinic. And we're going to talk about, yes, can you hear me? Okay. We're going to be talking about, obviously, the topic of dyslexia. And I'm going to just be giving you some information in regards to the treatment modalities that I provide and just giving you some education about dyslexia that we do at the Center for Pediatric Therapies. As of now, I am the only therapist that is providing this treatment, so I am kind of the only option if you have a kiddo that you're thinking about. But it is something we would like to pursue, getting more SLPs kind of working on that on our team as well. So I'm just going to kind of start with my clinical story, my clinical background, just to kind of let you know who I am and what I've been doing. So I got my bachelor's and my master's at the University of Northern Iowa. And then after graduation, I moved to Northwest Iowa. If any of you have heard of Orange City, not a very popular area. And I worked at a critical access hospital there where I served a variety of patients. I did inpatients, outpatients, nursing home, home health, pediatrics, and adults. So kind of did the whole gamut when I was there for my first couple of years. And then I moved back to this area. I'm actually from Charles City, and I worked in Charles City at their hospital for about a half a year while I was working on onboarding full-time here. So worked in Charles City at their hospital, and then I moved here, and I've been working for Taylor Therapy for almost 2 years now, doing outpatient therapy for primarily the pediatric population and adults if we get referrals. So, and like it says at the bottom, I have served both pediatrics and adults in my clinical practice. Oh, I think I went too far. No, I didn't. I'm so sorry. Okay. No, I definitely jumped. That's not the right slide next. Oh, my goodness. I'm so sorry. One of the slides moved. I'm going to move that. I don't know how that happened. I think in our process of doing that, it moved. Okay. Sorry, that threw me off. Okay. Let's try that again. There we go. Okay, so I also want to just give a broad overview of speech pathology in general. I know I'm here to talk about dyslexia, but if you are thinking of maybe a child that is yours or children that you work at in your school and you just aren't sure if they warrant speech therapy services, I want to just give a good old broad overview of some of the things that in speech pathology we do target and work on, if that is something that you're thinking about. So I'm just kind of going to go through that list. So we work on things such as speech sounds, so that could be the sounds that you produce. So maybe your child has a lisp and their tongue pokes out of their teeth when they're making their S sound, or maybe that could be on more of the phonological side where if your child is saying words and they constantly drop that final consonant. So instead of dog, they say dog, and that kind of goes across the board on a lot of their words. So we work on those things. We work on language expression and comprehension, so what we understand and what we do produce. Work on pediatric feeding and swallowing. That could be a wide variety of kids. That could be picky eaters, that could be selective eaters, that could be kids that have a feeding tube and they need more assistance in order to eat orally that they just don't have. We also work on people that use augmentative and alternative communication. So those would be kids that are not speaking or minimally speaking. And so we give them a form of a low-tech or high-tech device that helps them verbally communicate their needs. We work on fluency, so if your child has a stutter, voice, social pragmatic skills, so anything that goes in that, oftentimes you see that with people of different diagnoses, that maybe they lack some of those skills in those areas, and we can target that. Auditory rehabilitation, I will say I haven't worked on that specifically, but I do have some colleagues that have a little bit extra training in that, and they have addressed that. It's not an area of my specialty, but it is something that we can do. And then, of course, adult treatment, and I'll just kind of brush over that. Cognitive skills, speech skills, language skills, their swallowing, fluency, and voice. So that's just kind of speech pathology as a broad overview of all the areas that we can address. And if that is something that pops in your head about a kid that you know, or someone that is in the classroom, or your child, if you want to reach out to me after the presentation and ask more questions about that, you're more than welcome to. Okay, I'm going to make sure this went in the right order. It did. Okay, wonderful. That threw me off for a second. Okay, so for the rest of this presentation, we're going to kind of talk about dyslexia in regards to what it is and what I can do to help. I'm going to also address, what are your next steps potentially, or if you're suspecting a child has dyslexia, what should you do, what can you do, and then also what can we do, one as a speech language pathologist, but then also as a parent and potentially a teacher teacher or any other professional that works in the schools to kind of help them and accommodate for them so that they can be successful. So right here I just have a definition of dyslexia, so I'm just going to go ahead and read that, and then we'll kind of move on talking about more things. So dyslexia is a neurological disorder in individuals who, despite conventional classroom experience, fail to attain the language skills of reading, writing, and spelling that commensurate with their intellectual ability. So to kind of break that down, these are children that maybe are really strong in science and history and other subjects, but no matter how hard they try, reading, writing, and spelling continues to be a challenge for them. And then also, their difficulties typically result from a deficit in a phonological component of language that is often unexpected, kind of like I mentioned, compared to their other cognitive skills. So it might not be a child that you interact with them and you would expect that to come from them. It could be someone that seems, appears very, very normal when you're interacting with them and their cognitive skills, but they do have a challenge in this area. One thing that I wanted to mention is I really do focus a lot on the phonological component in my course of treatment, because that is an area that I really feel like is really important for those kiddos. So we'll talk about that later on, but that, when it comes to my treatment, that is something I really do heavily focus on. So yep, that symptoms one moved around. I wonder where it went. We're gonna have to go back. I don't know why that happened. Sorry guys. We're gonna jump back and forth a little bit. Looks right on mine. So okay, so let's just kind of talk about some symptoms that you may see for kids that may have dyslexia, or if you're wondering if they have dyslexia, you're not really sure. I'm going to read this list. One thing I want to make sure that you know is that not every child with dyslexia has every one of these symptoms. They may have one or two or three, or they may have all of them, but they could have some or all of these symptoms. So this doesn't apply to every child. Every child is individual, so it can look a little different. So some of these symptoms include their difficulties to learning to read, to write, and spell. And that's kind of what that big broad thing that you think of when you think of that. I do want to address it can kind of trickle a little bit over into math sometimes when you think about letters and the way they face and then the direction that they see them. So it can fall into math. I don't address math, but that is something that you may see. They have a hard time following oral and written instructions. So if you give your child a multi-step direction, go to your room, get your shoes, put your socks on, and we're going to go out the door. And they finish one of those things. They retain one of that three-step instruction. They retain one step. That can be hard for them. That can also translate over into written instructions as well. So maybe they have an assignment, they're reading the instructions, they complete the first step, and then they forget the rest. So that can be something that you might see. The handwriting can be very hard to read as well. Difficulty, the next two kind of go together. Difficulty staying on task, and they could be easily distracted. So maybe that attention can be a challenge for them as well. This is the one that is the most common. What people think of is the confusion in sequencing of letters and symbols. So what a lot of people think of is, if you have dyslexia, you think the flipping of B and D, and that is the most common one. It is there, but it also happens in P's and Q's, W's and M's. You might see, I have a gal right now that I'm working with that all the tails on her small letters are on the other side. So her A is supposed to go this way and hers goes the other way. So the direction her letters are facing is often the opposite way, and it's not always consistent. Sometimes she gets it right, and sometimes she doesn't. So, and then also just confusion in words that maybe have some letters and they mix those letters around, and then all of a sudden, instead of reading quite, they're reading quite. So they switched those, the I and the E, and then they now are reading a word that isn't in front of them. So things of that. And then, like I mentioned, it can trickle into math, that 18 and 81. So they may also have delayed spoken language, and I'll kind of talk about that a little bit further on, as well as why I find that to be important and why that needs to be addressed as well. Okay, we're gonna have to jump ahead. That should be the last time that happened. And just some other things. So confusion about directions, space and time, north and south, today and tomorrow, yesterday and tomorrow. And then the difficulty retaining information kind of falls with that retaining multi-step directions. So holding on to information in their brain long enough to complete that task or read that word, and we'll talk about that in a little bit as well. So we may also see some test-taking anxiety more than the average Joe. And we all have some form of anxiety, I feel, when doing something that puts us on the spot, or standing in front of people and talking, or just taking a test. And you might see that on a higher level. You might start to see that maybe they have some breakdowns or retraction, and that really can be a problem as well. And then finally, last two things, increase to reduce energy level. It can kind of go on both ends of the spectrum there. And then what I mean by immaturity is kind of social immaturity. We might see maybe they play with toys that aren't appropriate for their age. They might be interested in activities that maybe are a little bit younger than what maybe their average age kids are engaged in. So those are primarily a lot of those symptoms. And like I said, they may have some, they may have all. That doesn't mean every child that has dyslexia, you're going to see every one of these symptoms. So just kind of a handful of those. Okay, so let's kind of talk about what would you do if you have a child that you're working with and you're concerned about. I think dyslexia might be something that they're struggling with. School has mentioned it. Parents are concerned. We kind of want to, work towards figuring out, is that a diagnosis? Why is that important? Is it important? What would be your next steps? So first of all, what you would want to do is, I would hope your educational team, if they have some concerns, are sharing that with you as a parent, or vice versa. If you are a parent and you're concerned about it, you are sharing it with your educational team, so that that discussion can be started. And after that, what we would then want to do is, if that's something we all feel strongly about, we think this is something the child is struggling with, we want to give them more assistance, what can we do next? So, we want to seek a referral from your primary provider, and they're going to give you a referral to be formally assessed to either receive or not receive a diagnosis of dyslexia. And I have listed here some of those specialists that might be part of that assessment piece, or that evaluation piece. So it could be psychologists, a speech language pathologist, an educational team that focuses on dyslexia, and then reading and learning specialists. So you may have a handful of these people in on that evaluation to give you a formal diagnosis. And I just kind of have listed here, if you have more questions later, you can ask me, but these are just some areas in this, that I know of in this area, that are doing those formal evaluations to find out if children do have dyslexia. So I have those listed there. If you have any other questions, please ask me. These are the ones I'm most familiar with and I hear about most often. So, okay, so we either did or didn't receive a diagnosis, but if we did, what should we do now? You finish that evaluation, you get that information, and that can be really helpful for you as parent, or for the child to know, hey, this is what's going on, or even just school to know, hey, this is where their challenge is. So what would we do next? So I would encourage you to collaborate with your school team and start to make appropriate accommodations that are necessary for that child to be successful in that classroom or in that environment. So that's the first step I would encourage you to do. A couple things, I have a whole list of those things. If you want to know more about those after, you are more than welcome to ask me, and I can kind of send you a kind of a printed handout of what some of those are. Some children may benefit from some, they may not benefit from others, just kind of knowing that child and knowing kind of what their needs are. And then we also want to consider a 504 plan if they don't already have one. Can we put that in place for that child to kind of help them? And then finally, we would want to find additional assistance. So with reading and writing and spelling. And one of that being is myself, that's what I do. I can be that additional assistance for that child, or any form of a tutor, even if it's someone from out of the school or someone you know that kind of specializes in helping kiddos with dyslexia. That would be great as well. So one big thing to kind of think about when you have a child with dyslexia and why these considerations are important is they have to relearn and rehear and hear that information a lot more than that child that doesn't. So they need that repetition, they need that direct instruction, that one-on-one. They need to practice it over and over and over again. So as a teacher or a parent, can us as teachers, or as myself even, send stuff home with that child to be practicing throughout the week when maybe their peers are only practicing it once or twice in the classroom. They need to see that a lot more times for that to kind of solidify in their long-term memory. So that's kind of something that could be an accommodation. One thing that I would also recommend if you are a teacher, this is kind of more geared toward a teacher, but if you have a child in your classroom that has dyslexia and you know that, we know that reading is hard for them, so we want to eliminate any opportunities of embarrassment. So you know that child has dyslexia, we may want to prep them if we're going to call on them in class so that they could read maybe what it is you're asking them to read at home, prepare and practice. And primarily that is because Kids with dyslexia can only handle one cognitive demand at a time. So if we are thinking about reading and decoding words, that's a really high cognitive demand for them. And so to read that fluently in front of a class, when you have that anxiety that we talked about, that can be really, really hard. So giving them the opportunity to review and look at information prior to having to do it in front of their peers, but also giving them the opportunity to do that so they can participate and not be singled out, just so that they can be successful. So that's just a couple of accommodations. I have a lot of other things that I have found that are helpful, or things that I've been told are really helpful. So if you have any questions after, I'm happy to go through those a little bit more in depth with you. Wrong one, that was a mouse. Okay, so we kind of let ourselves into this. This is kind of what we already started talking about, but we want to have a couple considerations when we're thinking about those kids with dyslexia. I would encourage you as parent, teacher, myself, I even have to tell myself this sometimes, they are not lazy and they are not unmotivated. It is just super hard. So maybe if it's not sticking and you think, oh my goodness, we've done this a million times, that's not because they're not trying. It's just because this is really hard for that information to stick in their brain. So we need to just allow that maximum repetition until that child can put that in their long-term memory and now they've got it. So I would caution you not to think that that child is lazy or unmotivated. Just be reminded that this is really hard for them, and this is hard for them for a reason, and we're trying to help them. So, anyway, I already kind of mentioned this, but only ask that child to do something that you know they know how to do, especially in front of their peers. So, give them, optimal trials to practice and master this skill so that they can be successful when they're doing it in front of their peers, or even just for a classroom assignment. And we talked about eliminating those chances of embarrassment, so that could be, giving them the information, giving them the reading information or the writing information. A lot of the times, I remember I did as a kid, I liked to write on the board. I loved to write on the board if the teacher called on me to, Miss Shea, go write your name on the board, or go write what day it is on the board. So if we know that that child is their turn, it's coming up, give them an opportunity to practice, 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 so when they can go and do it in front of their peers, they're not going to be embarrassed or maybe have a mistake that they weren't planning on. So just giving them opportunities. There you go. Other considerations, we talked about this, making appropriate accommodations. Again, I have a long list of those. If you want to know more about those, I'm happy to share those with you. Identify their strengths. And I have found in my time with my kids with dyslexia, this is huge. I have a kid I'm thinking about right now that he kind of struggles with confidence. And he recently, in the last couple of weeks, has been telling me, Miss Shea, I taught my classmates this strategy. They didn't know this. I said, goodness, did that make you feel so proud of yourself? And he's like, yeah, they didn't know it. I knew and I taught them, and they thought it was really cool. I'm like, that's so awesome. Because he doesn't often get those opportunities to teach his classmates something or know something when it comes to reading, writing, and spelling that they don't already know. So identify their strengths, find out where they're succeeding. I have some strategies that I found work well for some students that don't work well for others, or maybe a different strategy works better. So it takes learning that child and getting to know them. They're all individual, they're all different, their brains all do function a little bit differently, so find what their strengths are. And then finally have good communication with the child in the school and all the outside resources that you're working with, that could include myself or someone like me, so that we're kind of all on the same page, we're giving them the optimal help that they need to be successful. Okay, so this is kind of what I wanted to, I said, talking about language and why that's important. I'm going to kind of draw that in because as a speech language pathologist, I can't not draw in language to the topic that I'm talking about. So in front of you, I kind of just have a diagram. It's called the 4-part processing model of word recognition. So when we think about reading, we have to get to that word recognition moment of we see a word, we know a word, and that's what helps us read fluently. And so it kind of takes a while to get there. There's a lot of steps to get there. So I'm going to kind of talk through this in regards to how do we get to that, just so we understand what we're asking of children and what kind of skills they come before they're able to do that. So kind of starting down here bottom left for you guys, bottom left corner with phonological processors. So that's kind of where it all starts. So we process our language from both an input and an output method. So input basically meaning understanding what you're saying to me. If you say, Shay, go open the door, I understand what Shay, go open the door means, and I go open that door. And then from an output perspective is maybe I want you to open the door, and so then I say, Mom, open the door, and then you go ahead and complete that activity or that task. And then we jump over to orthographic processor. So what that means is, Again, that also occurs from an input and an output perspective. So instead of just from the verbal language side, we're now doing it from kind of that written and writing side. So we need to understand information by what we're reading. That's how we learn. We read and we learn. And then we also need to be able to express ourselves by writing. Like if I want to write you a thank you letter, I need to be able to express that and write that down. So that's my output. And these two things are connected by phonics or phonemic awareness, which is kind of right there in the middle. And we'll talk about that a little bit later as well. But having good phonemic awareness and a good understanding of phonics is important for us to move on as we become readers and writers to those next steps. So right now these kids are learning to read, and we want them to eventually learn or read to learn. So we kind of got to get them there. And then we go to meaning processor, and it kind of mentions their vocabulary. So what that means is when we now have information, we need to associate that the sounds we hear go together to make a word. So if I said jump, now all those sounds that I learned about in that phonological processing spot mean to jump. That's what this means, I can jump. So that is important to understand what that means. I need to know that the word jump means to jump. So, and then finally we go up to context processor, which is kind of the last step of that whole processing for word recognition. And basically what that means is, I didn't use a good example for jump, but if we used an example for the word like stable, a stable has multiple meanings. So a stable could be where a horse lives. It lives in a stable, that's where it lives. But it also could mean if I'm going to walk across the bridge, I hope I'm really stable and I don't want to fall. And we need to be able to read the information surrounding that text to kind of put context to what it is that word means, so we know what actual vocabulary term we're talking about versus stable versus stable. So that's kind of what that means. So that's kind of that process and working on that model of word recognition so that we see a word, we know a word, we know what it means. We can use it too. And then I addressed earlier that I was going to address phonological skills. So this is somewhere I want to kind of mention that in my treatment with kids with dyslexia is really heavily targeted if these are skills they do not have yet. Sometimes kids that I work with do have these skills, so we may brush up on them or do them for a more advanced level. But if I have a kid that comes into my room and they don't know how to do these things, this is a really important foundational skill for these kids. Kind of when I talked about in that model right before, we need to have good phonemic awareness. And what I mean by phonemic is sound, good sound awareness. So that shows up in a variety of different ways, but we have phonological processing as a big umbrella term, and then we have all these skills underneath that kind of help us develop to be a good phonological processor. No one's here. I thought someone was coming in. Okay, so just going to brief on all of these. So verbal short-term memory, basically that just means that I am able to retain the information that I just produced when I decoded this word to remember what I even just said out loud to know what the word. So if I said, again, I'm going to use jump, jump. I need to remember that long enough that I said those 4 sounds. And I have a lot of kids who can't do that. So if they might say every single sound in that word, jut. And then it comes out jet. They just told me every sound, but their brain could not hold on to those sounds that they just said long enough to blend it together correctly. So that's kind of what that refers to. And the rapid serial naming would basically just be naming letters in a row, numbers in a row, objects on a paper. So being able to have that skill. And then the articulation speed is exactly what it is. You know, I need to be able to produce sounds quick enough so that I can hear them correctly so that they come out correctly. So if I say jump, I need to say it quick enough that all those sounds go in the correct order and then the word comes out as jump. And then finally, the phonological awareness and kind of pops down to phonemic awareness. And we'll talk about that as well in the upcoming session or slides, but that basically talks about rhyming, segmenting, blending, moving sounds around, being able to manipulate sounds without having them in front of you. That might be counting syllables, that might be counting words in a sentence, things like that. So this is something that I do address a lot in my treatment with these kids because if they don't have the skill, we're going to have a really hard time moving forward. So that is phonological processing. And then I just kind of talked about this, but these are those phonological skills that I was talking about. So rhyming, hat, cat, hat. Syllable blending, this isn't a good one, but if I said bunny and I said, what's the second syllable of bunny mean? knowing what that means. Segmenting, at. Blending, at, pat. And then sound addition, deletion, or substitution. So if I said, what's pat without t, pat. What's pat, but let's switch p to k, cat. So some of those skills that we can automatically do really fast, but can be really challenging for a child. Okay, so that's kind of that background information. So now kind of talking about how does this look in my treatment moving forward if I would have a child come to me, or if you're wondering if this child should come to me. So basically, what I have to do first is assess the child. So what I do is I obviously collect background history. I collect a current problem list. You know, what's parents' main concern? What's school's main concern? What diagnoses do they have? They may have more than just dyslexia. They may have something else they need to know about. And then I administer a battery of assessments. So it does kind of take a little bit of a while. My little kids don't love it all the time, but I encourage them for getting through it. But it just gives me the understanding of where they're at in a variety of things. So I administer assessment for reading comprehension, written expression, their phonological skills, and language. So I want to know all those things. And then finally, I also then administer probe sets for reading and spelling, not just single words, that I've gotten from the Orton-Gillingham training that I have taken, to know where we are when we started, and also to know where I need to start. Because if a child has a certain knowledge of a skill, I don't want to redo it. So we need to know where they are so that we can move forward and be effective and efficient. So just to kind of explain how, again, I utilize the Orton-Gillingham approach, that is the training that I received for working with kids with dyslexia, is the Orton-Gillingham approach. So basically what I do, and I'll explain why, Orton-Gillingham has a pretty set structure in which you teach information, you practice information, and you go through it. I believe it is more geared towards in a school environment. So these people are seeing these kids maybe 5 days a week. I don't have that opportunity. I can't do that. I can see these kids once a week and maybe twice a week if we can get it with insurance. So I do a modified version of the Orton-Gillingham approach. I'm utilizing all their principles, but I can't follow it quite as rigidly. And I've learned that in the last year working with my kids, just because of the sheer fact of, one, I only have 40 minutes, and two, I only can see them once a week versus 5 days in a week if you can at school, because some teachers also implement this as well if they are trained. So they receive 40-minute sessions, and like I said, once a week they come see me, and maybe twice a week if we can get that approved by insurance. That's the tricky part, that I have to work with insurance, and school doesn't necessarily have to do that. And then I send them home with take-home activities and homework that I really ask them to do throughout the week. And I can definitely tell how much better kids do when they do versus when they don't. And that is going all the way back to those kids need maximal repetition. So I want them to do this every day at home so that they're getting that maximal repetition that maybe their peers don't need, so that I want them to be successful. So that's kind of what that looks like for me downstairs at the Center for Pediatric Therapies. I also do it in Parkersburg too, so if it's somebody over in that area, I can do it over there as well. Okay, so when it comes to the Orton-Gillingham approach, I'm going to just kind of talk about some of the ways that Orton-Gillingham kind of structured their approach and why they do it this way and what is helpful about it. So the Orton-Gillingham approach is systematic, sequential, and cumulative. So basically, and this is very true, lessons are very repetitive and they are procedural. It's a lot of tabletop work. We do have fun, but it is pretty structured. It can be different than a lot of other speech therapy sessions that maybe if you're working on sounds or if you're working on different language skills, it looks a little bit different. We are sitting at the table, we are working, and we are working hard. So we do a lot of that, and we work on concepts that are simple, and then it becomes more complex. So for example, if I was teaching a child, we also work on morphology, so like plurals, past tense, things like that. So I'm going to teach them the plural S first, because that's the most simple. Our language is really interesting. I've learned that over this time of learning about how to administer this stuff to these kiddos. We have a lot of rules, and there's a lot of exceptions. So, and then we'll move to plural ES, and then we're going to move to plural IES, from fly to flies. And then we're going to move to plural VES, from loaf to loaves. We're not going to do all those things at the same time. We're going to start with one, and we're going to advance moving forward. We might talk about one concept like OR says OR, and then we might come in a couple sessions later, now we're talking about AR says R. And we're going to talk about why we've already kind of done that. So it just goes from simple to more complex. And we build like it says, building on previous content. So we continue to build on things we've already learned. So, and also that repetition with kids with dyslexia is very, very important because they may know that skill in that moment, but maybe it's not put in their long-term memory that they have it. That they, no matter what, you move on, they can do that skill. And I may find one day, oh my goodness, they've got it, and then we come back a week or two later and, oh, that fell out, we need to bring that back in and continue to do that repetition. So if anything, what I want to say is repetition is so important for these kids. And content is always reviewed. So I always review things. If we see a word in a reading, hey, that's our H brother rule, our SH. Remember when we talked about that? What does that say again? So just kind of always bringing things back in so nothing goes out too long so we lose it. And then there is a sequence in which Orton Gillingham kind of sets up the training for which you teach phoneme rules and different patterns, and it's intentional. So I follow that to pretty much the best of my ability. Sometimes a kid may have one of these things, so we kind of move past that, move on to something else. We may modify it if a child is learning in a different capacity. So like I said, I do modify it slightly, but that's because I'm in a different environment than the school environment. So. And then I do provide a lot of explicit and direct instruction. So we oftentimes pull our chairs up to the whiteboard and we do a lot of talking and writing on that whiteboard, or we have our own little whiteboard and we do a lot of teaching. So we make sure there has a lot of teaching of understanding what this is, why we do this, where does this go? Okay, now I'm going to do it for you. Now let's do it together. Now you do it. So there's just a lot of gradual release of support. So right away, any new concept is all the help. And then as I start to see them improve, I release help, so that they can start to do it more independently. And the other thing that Orton Gillingham really focuses on, that I also focus on, is a multi-sensory grammar for dyslexia. So constant review information, adding one new concept at a time. So that is something that is highly recommended, and I've also found to be very true in my practice. Is if I do too much, kind of how I talked about, they can only have one cognitive demand at a time. So if I try to introduce this and this at once, it does not go well. So trying to introduce just one new thing at a time. And it is absolutely necessary to overlearn. It is so necessary. So you may feel like you have done this a million times, but that is necessary and it's important for that child to get that stored in their brain. So we need to overlearn. We need to teach one new thing at a time. And we explicitly do teach them grammar. So again, this is to assist them with comprehension and to improve their written expression. And one thing I want to say about that is, if you're working with a child that maybe reads the whole story, they read every word correctly, that's so awesome, and you ask them questions about it, they may not be able to answer your questions. And that is because it was so hard for them to decode all those words. They were not able to comprehend what it is that they're reading. So I would encourage you, if you're working with a kid with dyslexia, have them read it twice. The first time is so that they can figure out those words, and then the second time is so that we can understand or comprehend what was put in front of us. So, and by multisensory, basically what it is just right here in front of you. So we work on things that we hear. We give a lot of visual supports. I give a lot of tactile supports. We might write it if you saw, which way was it? That how he's writing in some sand. Sometimes I have like carpet. We'll write on, practice some letter combinations on carpet. We'll practice anything that's a tactile surface, just so they can have that tactile input as they're practicing what it is that they're also saying at the same time. And then kinesthetic, so body movements. So maybe I have a kid that really likes wrestling, and so we've talked about it and put it into terms of wrestling sometimes, of if there's 3 letters that go together, we talk about 3 steps that you need to do a takedown, and then we kind of do it. I have him act it out so that he's having those body movements while he's trying to recall those letters that he's working on. So that looks different for everybody. And try to draw on what their interests are, otherwise they don't care as much. So find what their interests are, and that's also important. Yeah, so basically what we're working on are all of these things. So what I want to I'm getting close to wrapping up here, but what I really focus on in my treatment, which is what I want you guys to know, is working on teaching how our language works. So I work a lot with phonemic awareness. That's kind of my first step with these kids. If they don't have that, we do that for quite a while. And the reason is if we can't segment words like slide, eyed, we're gonna have a really hard time reading. So we need to be able to break apart those words that are a little bit longer than just cat, rat, mat, things like that. So I work on that quite a bit. I do use a lot of visual and tactile things to help with that as well. We work on 6 basic syllable types. And that is something that I start to work on with kids as they kind of advance through the program. So thinking about words that have, I'm not going to go through all these, but there's 6 basic syllable types so that we can help ourselves read longer words. So if we can understand what those are, explicitly teach them, practice doing them on paper, reading and writing, that's going to really help us as we need to decode those longer, more complex words. Different spelling patterns, and then morphology is a big one that I work on. So if you don't know what that means like root words, prefixes, and suffixes. So I've been doing this with my wrestler buddy, but if we were to say, we're going to add to the end of our word, so he likes to wrestle, and then now we could use the word wrestler. And what does that mean? How does that change that word? Now that is the person who wrestles. So to teach is the act of teaching, but a teacher, when we add that that ER at the end, that is the person who teaches. And so we work on those skills as well, so that he understands when he hears that in teacher, oh, that's that ER, it's the person who teaches, I recall that. So really teaching those morphology skills to help them understand that as they move forward. And finally, just kind of wrap up, so that's kind of how my treatment works with those kids. I could go in way more depth, but I'm not going to. The things that I really want you to remember in regards to kids with dyslexia is to focus on their strengths and always provide positive feedback. So it can be really discouraging to be that child who has dyslexia, and you maybe just feel like you're constantly failing or just not getting it. So when they get it, we want to praise them, we want to encourage them, I want them to feel proud of themselves. Sometimes I ask them, do you feel proud of yourself? And oftentimes the answer is, yeah, I do. And I love to hear that from them because I want them to feel successful in an area that maybe they often don't. So provide positive feedback when they are getting there. Oh, that was so close, you missed just one thing. So instead of being like, oh, that's not correct, we want to give them in some form, how can you encourage them? I do personally feel it is important to discuss the child's diagnosis and why they face these challenges so that they know why this is so hard, that there's something you can pin that to. I just think as human beings, we like to know the cause of things, and if we know the cause, it kind of helps us work through it or feel better about it, and when things are unknown and there's not a cause, that can be really frustrating. So I do talk about this with them, of this is why this is hard, that's why this is challenging, but look what you're doing, you're working so hard and you've improved, you're making progress. So I feel that can help increase their confidence and motivation as well. And then I have it there again, and I probably said it a million times, but encourage them, encourage them, encourage them. If they don't feel encouraged, motivation is low, it's something they don't enjoy doing, they may not try, and like I said, always presume hardworking, but there are times maybe they aren't trying, and we need to encourage that they want to try. And then consider their challenges, have patience. It can be as a caregiver or a teacher or the person helping them, it can be almost challenging for us to have patience because it is so hard for them. So we need to recall that this is hard for them, and that's why we're helping them. And then always express to them that they are able to achieve, they are able to do this. I have had a lot of kids say to me, I just can't do it. And I don't let that sit in my treatment room because that is not true. And they can do it, and this is what we're going to do so that you can do this. So these are the things that I think, if I could make sure people really remember if they're working with kids with dyslexia, is these 5 things. These 5 things I think are going to make a huge difference for those kids if you're working with them, if it's your child, if it's your student, whoever it is, so that they have motivation, they believe in themselves, and they understand what's going on and why it's going on. Yes, so does anybody have any questions for me?
I'm wondering what ages of kids you're normally working with.
Yes,
and
so
kind of when is maybe the ceiling for some of those therapies.
Yeah, so I don't know if they can hear that on there, so I'm just going to re-say your question. So the question was, what is the age of the kids that I'm working with currently, and is there a ceiling, or what is the ceiling of those kids with disabilities? It's a great question. you can really start relatively young. So if we're getting into those pre-reading skills or those reading skills and we're starting to notice it's a challenge, it's often better to get in there and get helping them right away than let's wait it out and see. Because if it is something that's present for that child, it's just not going to get any better. It's still going to be really hard if you're not getting the appropriate accommodations or the appropriate educational assistance. So when you just even thinking about letter sounds or phonemic awareness when you're in school, as you are doing those things in the classroom, that's a good time. 5, 6, sometimes even 4. I don't have any 4-year-olds right now. I would say the age range that I have right now, and these are just the patients that have been referred to me and the ones that I'm working with, I believe it's about 7. Nope, 7 is my youngest right now, and I have to 10 and 11, I believe. So it's kind of all in that range right now, but that doesn't mean that's the only range you can do. That's just the range that I have been gotten referrals for and been working with. So I have not had this. I have a friend in Charles City. She's a speech language pathologist as well. She's fantastic, and she's providing this treatment as well. And she let me know a couple weeks ago that she actually has a high schooler that she's working with. So she took the same training that I did. She has been practicing for many, many more years than I have. She's almost in her 60s, so she's been doing this for a really long time. But she did share with me she has a high schooler that she's working with. Talking a lot about kind of what I mentioned briefly, those syllable division rules. Some of those more advanced rules that you don't maybe address as soon as you do with a 7, 8, 9-year-old, because it's either above their cognitive abilities or the skills that they should have, or even what their peers are doing. So I could ask her more about what that treatment looks like. I have not had anybody that old, but that doesn't mean you can't.
And then as you're using that program, do you feel like you're getting to the point where, okay, they've achieved these skills that we're working on, they have come to the end of that program? How do you handle that?
Yeah, and that is a fabulous question, and I would say that myself, as well as my friend in Charles City that I'm talking about, we kind of did this at the same time. That is a great question that both of us still feel like we're trying to figure out the answer to. There is not a written rule of, okay, once you do this, you're done. And so I would say it's a little ambiguous. I haven't found my kiddos being at that spot yet because none of them I've really worked with for more than a year. And again, I see them once a week because I started doing this treatment maybe a little under a year ago. So I haven't reached that point yet. It is not explicitly recommended in which that time comes in the training. So I would say it's a little ambiguous in regards to what that, okay, here's the cutoff. And that's a great question because that's a question I have for myself as well.
Insurance too.
Yes, that is true as well. And one thing that's different for speech, which I express to parents quite a bit, versus like working on these skills in the school, I have to have approval from insurance. And right now when it comes with insurance, if the child does not score below 85, which is our standard deviation, if they don't score below that on any of the tests I give them, so the language test, my phonological test, or it's called the OWLs, but the written expression and the reading comprehension test, if they don't score below, I can't pick them up. So even if
on all of those, or
just one, I see one, yep. Just one of those scores needs to be 85 or below. And I haven't run into that too much yet because if the child's coming to me with a diagnosis of dyslexia, more than likely they're going to really, well, not really struggle, but they are going to score below on one of those assessments. I have come across it where I believe it's just been once that a child did not, and I kind of, my hands are tied because insurance won't approve a dyslexia diagnosis code only for speech. They have to have a phonological impairment or a language disorder or a written expression disorder. That's one I've used as well. But you can't just say they have dyslexia, approved therapy. So unfortunately, that is what it is right now. I don't know if that'll be how it is for moving forward, because I would say quite a bit more speech pathologists are starting to do this now, or starting to realize, hey, this is something we can do, or here's kind of our role in this. We can also help in this category of kids. So it can be tricky, and that is a great thing, and I'm glad you said that, because I have to tell parents if I give assessments and I don't get a score below, they may have dyslexia. My hands are tied. I just can't get approval from insurance unless they would like to pay out of pocket, which is always an option. Not a lot of people like to do that, and I don't blame them, but yeah, there are some guidelines in that. And one thing I was going to mention quite a while ago, and I did forget, Sometimes I also have parents coming to me thinking I'm diagnosing your child with dyslexia. I am not. I do not diagnose dyslexia. That's when I recommend you go and get a formal evaluation with all those different disciplines because I think that's valuable and I think that's necessary. I will recommend, if I think you should further, a formal evaluation to receive that diagnosis, but I am not giving a diagnosis of dyslexia if they come to my treatment room for an assessment. So I do explicitly share that with parents as well. And I'm not diagnosing your child with dyslexia. I can't help them. If they score where I need them to score, I can help them. And I'm more than happy to help them use strategies to help you guys. But if you want a diagnosis or if you're wondering if you have one, do go and get a formal evaluation in Iowa City or Mason City or Des Moines, wherever that would be. So, forgot to mention that. I wanted to. Any other questions? Or anything that didn't make a whole lot of sense? Perfect. If not, thank you for having me.
Thank you.
Fun helping you guys.
Very nice, Shay. Thank you so much.
It's red, so I don't know if it's done. Charge.
Yeah, we'll get it. Don't worry about that.